Being a student in the nursing program means a lot of hands-on experience both in and outside the classroom. We caught up with an assistant professor and student to tell us how they're taking their experience in Murray State to a whole other part of the world.
Every once in a while there are opportunities to present internationally. They're not nearly as common as those presentations that you can apply for in Kentucky and at local hospitals. So there actually are two of us faculty members that decided to apply for this presentation.
Jessica will be taking her work with Murray State halfway across the world to Prague. She'll be presenting her research in nursing at the International Research Congress.
Last year it was in Brisbane, Australia, and I attended that, and I decided I wanted to apply for the conference in Prague. So basically what it'll be will be a lot of nursing researchers that come together and do a presentation at various times. Last year I did a poster presentation, but this year I'm doing a podium presentation, so an hour-long presentation about my area of interest. I did my dissertation, finished about a year and a half ago, and it was about critical thinking skills in baccalaureate nursing students, and it was a quantitative study. And so I've gone further and done the qualitative portion of this, and so that's the research that I'm going to be presenting in Prague. And I've actually been working along with a student that we've been doing a lot of research together. He's been helping a lot with the analysis of my qualitative data, and so he is going to have the opportunity to go to Prague too. And there's another one of our fellow faculty members in Knoxville at University of Tennessee who's also been working with us that can go to Prague too.
Jessica has had the help of senior Craig Shadler to prepare her presentation this summer in Prague.
The title of it actually is it's a narrative thematic analysis of baccalaureate nursing students' nurse-patient clinical reflections is what it is. And we kind of examined student reflective writings about critical thinking, and we open-coded them is what it was called, and then we developed different themes based on their writings. And it was kind of a tool for teachers to use as like, these students are critical thinking in these ways, using these types of methods, and it helps teachers realize maybe these students aren't doing that yet. So kind of just like a teaching factor kind of is what it was.
Craig has not only been a big help to Jessica, but she's also helped him with his undergraduate education in the department.
Well, I had her when I first came into the program as a sophomore teacher, she was there for our first set of clinicals and things like that. And so I've been in and out of her office ever since the beginning, and she's been extremely helpful. I was so glad that she let me take this opportunity to help her out in the research. Anytime I need something, she's there. She answers my emails right away, things like that. I can just stop by her office, and if any questions I need, she'll answer them for me. So
some of the benefits, which you'd see this across campus, are the class sizes. We only usually admit somewhere between 35 and 40 a semester. I would say definitely we all know our students by name and we know them personally, and I think for the most part they feel that they can come to us and talk to us about any issues they have. They communicate with us very well one-on-one because of that class size. We also have opportunities to go to both rural and some urban facilities, mainly rural, so you kind of get to see that.
The Murray State Nursing Program not only offers students a one-on-one relationship with their professors, but the success rate for job placement after graduation is extremely high.
I would say we have a very high percentage of NCLEX pass rates. NCLEX is the licensure exam that you take once you get out, and our pass rate's been high consistently. Also, we have a very, very high job placement, so as soon as you get out, there's going to be a place to work. And some people decide to go back to urban settings or to their hometowns to work, and many work around here. Either way, there's a high percentage job placement.